GV Black's classification of dental caries is the standard method used in identification of carious lesions according to its location on the tooth surface. These cavity classifications are used when recording on the patient's chart the type of caries found on the teeth. According to GV Black classification model, dental caries can be classified into 6 classes based on the location of caries. GV Black Class 1 caries are pits and fissures of occlusal surfaces of premolars and molars, buccal or lingual pits of molars, and lingual pits of maxillary central and lateral incisors. Class 2 caries involve the proximal surfaces of premolars and molars. Because proximal surfaces are very difficult to visualize posteriorly, detection very often requires a radiograph. Also, it is difficult to access a proximal surface carious lesion from the buccal or lingual. The design of the cavity preparation will also involve the occlusal surface, and often more than 2 surfaces. Class 3 caries involve proximal surfaces of incisors and canines. Caries often extend to buccal or lingual surfaces from the initial proximal surface site. Class 4 proximal mesial or distal surfaces of anterior teeth with involvement of the incisal edge and angle of the tooth, often related to trauma to the anterior tooth involving fracturing of the incisal edge and line angle of the tooth with subsequent dentin exposure. Class 5 caries involve facial or lingual surfaces located in the gingival third of anterior and posterior teeth without any pit involvement, often related to excessive plaque buildup at the gem-like from poor oral hygiene or reduction or absence of salivary secretion in the mouth. Class 6 caries involve incisal edge of anterior teeth, cusp tips of posterior teat, often related to attrition from chronic habit of grinding teeth. Bruxism with subsequent exposure of dentin can also be related to cusp tip trauma or enamel defects.
Thank you for watching.